The coronavirus or COVID-19 has brought life to an almost standstill in most parts of the world. The COVID-19 outbreak was brought to light on the 31st of December. Since then, there's been a lot of confusion regarding the pandemic. To get you some clarity on the do's and don'ts, we have our doctor joining us at the moment. We have Dr. Neeraj Jain, Chairman of the Department of Chest Medicine at Sir Gangaram Hospital in Delhi. Very good afternoon, Doctor. Welcome to the show. We just heard now private labs are going to be allowed to test about 35 of these private labs and 109 of the government labs. So will we see a spike now in the number of cases?
I think the cases are already there, in my opinion. It is true that we could have had more tests to get more accurate numbers, but I have said this before, I don't think that is the most important thing. The important thing is to work on containment measures. Yes, so we may see an increase in the numbers because the diagnostic capability has been increased in terms of numbers. So that is should not be alarming. I think that is something that we all expect to see. The question is whether it will follow the same trend that it has done in the other countries, which is basically peaking and then plateauing and then falling from anywhere between 6 to 8 weeks time. And that is the important thing.
Right. So, Doctor, you think that this would take up to 8 weeks before we see a decline?
I think if you look at the trends in almost all the countries, if you follow the graph, you're looking at a 3-month cycle. If you project ahead, that the number of cases have increased and then they plateau and then they start declining because all the measures that are taken to contain the disease, be it contact tracing, be it isolation, be it social distancing, all the measures. And which is why I think our country is a little ahead this time, in my opinion, because we have taken the preventive measures very early on and the numbers will actually come in. So one should not be alarmed if, you see tomorrow that there are 1,000, 1,500 cases who've been diagnosed positive. These cases are already there. They're just being tested more, I think.
Right. We have a caller calling from Jalgaon. We have Tirtharaj. Tirtharaj, what's your question?
Yes, sir.
Go ahead.
Yes, sir.
Right. Please go ahead.
Can this COVID-19 survive on water or in water?
Doctor?
So there is not enough evidence to suggest, when you say surviving in water, I'm not sure what you mean. If you're talking about still water in the houses, as we talk about, mosquitoes, for example, if you talk about stored water, then it is unlikely. You see, what's happening is the virus needs certain conditions to survive. It does not survive on inanimate objects for any length of time. So it has to gain access to a living organism. So it is very unlikely that the virus will stay in water as well. But,
right, Doctor, if one doesn't have a soap or a sanitizer, just washing hands with water, is that enough?
So you need the detergent effect because you see, when you talk about proper hand washing in this scenario, you're talking about washing your hands all the way between your nail beds, between the fingers, and that only water may not suffice. So you need any kind of detergent. It doesn't matter what soap it is. A detergent actually gets in where normal water wouldn't and just flow away. So detergent stays there, you can clean it, scrub it, and then wash it. That is probably the best way.
Right, Tirtharaj, I hope that answers your question whether, this virus can stay in water or whether, it's just water enough to get rid of this virus in case, you tend to contact anything. Well, next caller is Sukhwinder Singh calling from Delhi. Sukhwinder, what's your question?
Yeah, hi, I'm Sukhwinder. I'm from Janakpuri.
Right. Please go ahead with your question.
Yes. I have a low-grade fever since last Sunday. So, and I have a slight throat infection.
Right. Dr. Neeraj, he has a fever and a slight throat infection. What should he do?
So again, I think the guidelines are fairly clear. There are lots of viral infections around, including influenza. There is some swine flu also, which we are seeing time and again. The important thing is, have you been in any high-risk contact in the last couple of weeks, let's say, whether it's somebody who's traveled from abroad, somebody at home who's been symptomatic or diagnosed positive later, That is the important question you need to ask yourself, because then you need to isolate yourself at home, which is a self-quarantine for about 2 weeks, to try and protect other people. You must not forget that 95% of healthy people with this disease will recover completely without any complications, provided they rest and keep themselves well hydrated and well nourished. So I don't think you should worry about the coronavirus infection if you're otherwise healthy and you don't have any chronic disease of any organ, and you have not been in contact with anybody who has been diagnosed or who's suspected to have corona or who's traveled from a high-risk area.
Doctor, it's been raining on and off in the national capital. Will that have an impact on the spread of the coronavirus?
I don't think, the country has been looking forward to a hot, dry summer more than ever this year. I think everyone is hoping that we get the hot winds, the dry weather coming in, because the belief is that the virus will not survive for very long in those conditions. So, and there is some basis for that based on previous studies on viruses. So yes, I think this weather can prolong the survival of the virus and increase transmission. So people have to be careful. Don't forget, your early morning temperature, for example, today was cooler than normal. So catching a chill, exposing yourself, letting your body resistance fall temporarily are all realistic possibilities. So yes, one has to be careful. And till the weather becomes drier and hotter, I think we need to be very, very careful.
Thank you, Doctor, for answering our questions. We also have our other panelists joining us at this point in time. Dr. Sameer is joining us. Dr. Sameer, would you like to take our next question? Mukhtar is calling in from Srinagar.
Good afternoon, doctor.
Mukhtar, please go ahead.
Good afternoon.
Good afternoon.
My question is, if any patient gets recovered from the virus, whether that virus gets completely wiped out from the patient or it remains inactive in that patient.
Dr. Sameer, would you like to answer that?
Yeah, so, your basic question is how long are you infective for, right? And, from most of the research and data we've shown that your infectivity dies down after you recover. So, typically the data, the guidelines are that if you catch, you get infected, you have to keep yourself isolated for 2 weeks after you are exposed, or if you're after you're exposed. Now, supposing you have contracted the virus and you show symptoms on day 9, for example, then you have to stay indoors for at least 7 plus 9 days. So you add 7 days on top of that. And now there are also to reduce the infectivity period, and it is also 7 days or 48 to 72 hours after you are absolutely normal, to reduce the infectivity of the person concerned. So supposing you get a fever on day number 10, then you stay indoors for at least 7 days. But if on the 7th day you are still ill, then you add and you completely recover on day 9. Then on day 9 plus 48 hours and a negative sample.
Thank you, Dr. Sameer Gupta, cardiologist from the Metro Hospital here in Delhi. Our next caller is Vineet calling in from Delhi. Vineet, what's your question?
Yeah. So my question is, actually, I'm suffered a seizure attack 6 years back. It was about to close last year, but again I got an attack. So I'm on Levipil for last 6 years, 500 mg morning and night. So am I a vulnerable case if I do get this coronavirus?
Dr. Neeraj, would you like to answer that?
Sorry, I missed the what did he suffer from? I missed that initial bit.
Right, Vineet, could you please repeat your question?
Sure. Sir, I suffered a seizure attack 6 years back, and since then I'm on Levipil 500 mg morning and night. It was supposed to close. The course was supposed to end last year, but I again got an attack. So this neuro problem that I'm having for Levipil 500 mg, I'm a vulnerable case for this COVID or not?
No, Sameer, I don't. No, you're not vulnerable any more than the person next to you who doesn't have a seizure disorder. And Levipil is not a medicine that lowers your immunity in any way. So you still follow the same principles that any normal individual would. So please don't worry on that account.
Right. Our next caller is Usha Ramachandran from Vellore. What's your question, Usha?
Yes, ma'am. Ma'am, I have one doubt, ma'am. My children are doing work from home, ma'am. So they are at home and I am housewife. So we are all locked down. But my husband is a banker, ma'am. He goes out daily. What are the precautionary measures I have to take to tackle this, ma'am?
Right, a very, very good question. Dr. Sameer Gupta, would you like to answer that?
So as healthcare providers also, we are on the forefront, and we are also going to work and taking care of our emergency and sick patients. Elective cases and elective procedures have been put on hold temporarily, and I'm sure my panelist doctor would agree with that. However, emergency we are still tackling. So I, as a doctor, am still going to work. So the precautions that I personally use are precautions that I will also tell you. And they're all very simple things: hand hygiene, social distancing. As healthcare providers, we are actually instructed to wear a mask in the facility at all times. I wash my hands regularly before going to work, after going to work, after I touch anything. When I come home, also I have I have a pair of shoes which I use to go to work, and I leave them outside the house. And then as soon as I come into the house, I directly go to the washroom. I take out all my clothes. I put those clothes for washing. There is a container with there's a bucket with some detergent that has been put. I drop my clothes in those detergent. I take a shower, I wash myself nicely, and then I come out. Those are just some of the practical tips that are going around in the medical circle to try and reduce our risk. Once again, there is no sure-shot way. People have often asked me, like, how long is this lockdown going to last? And I think I would like to repeat what Dr. Tony Fauci, from the advisor in the US for President Trump, what he said was, he's like, you and I don't decide how long this will go. The virus decides. And I think that's very accurate. That's very true. We don't know how long this is going to go on. Hopefully this will close sooner than later. But those are just some simple practical tips that we can recommend. And I don't think anybody can be overcautious.
Right, big worry amongst
Can I
people.
just add something to that? Sorry, can I just add a very important thing, in my opinion,
right.
If you're in the banking profession, even though banks are paperless and you don't have that much contact, but if you're handling cash or papers which are being handed over to you by a client and you're handing them back, then please, in between every contact, please have a sanitizer, use a sanitizer before you go on to the next client. It's very important because then at least cross-transmission will be prevented. So, I think it's very important for people who are in public dealing. Basically.
Right, doctor, one's out to get groceries or even at a doctor's clinic in terms of payment, if one has to use a credit card, how safe is that?
I think it's not a big deal. Look, we can easily go overboard. If there is a direct contact with something that is animate, or if there's a prolonged contact, yes, you need to take precautions. But like Dr. Sameer said, when you get home, ultimately, you should discard anything that is a possible source of infection to your family and put on something that is absolutely clean. The virus does not survive otherwise. So it's not something that, is going to blow in the air as soon as you come into the house. It's not going to happen.
Right. Our next caller is Saeed Jaffrey calling us. What's your question, Saeed? Saeed, if you can hear us, we'd like to know what we can help you with.
The World Health Organization and health authorities, they are giving the message that soap is enough, or alcoholic hand rub is enough for killing the coronavirus, actually.
Right,
actually,
Saeed,
I want to know, the people are thinking that commonly bathing soap is they are using, actually. Everywhere we can see bathing soap. This bathing soap is enough to kill the coronavirus, or any other peculiar or specialized soap is wanted or not?
Dr. Sameer Gupta, is a bathing soap enough, or do they need to take more precautions?
I think, at this point, everybody just, Dettol and these other fancy soaps are not practical for mass consumption. They're not even actually available. So I think a good hand wash with soap and water, good wash where you're taking care of your palms, your nails, you've got your palms, your nails, your thumbs, the back of your fingers. This is where the virus can actually lodge, and a good wash is very important. I would like to add one more point to our previous conversation, what my esteemed colleague had mentioned, that and I see a lot of people, like when you go out and buy groceries, or when you're going out to the bank, for example, some people wear gloves, right? And they feel that, oh my God, I'm wearing gloves, this is great. But the fact of the matter is, the virus can still be on your glove, right? It can still be on your glove, and you take that glove and you touch your face, you touch your nose, you touch your hand. The virus is transmitted. It is not that, your glove is this, because this is not something which spreads by, like measles or chicken pox. Measles is a bad example, but, something which spreads from one person to the other just by touching. The virus stays on the glove. So you take that glove, you touch your face, you touch your hand, you are spreading the infection. So be very cognizant of that. Gloves are just give you a false sense of satisfaction.
Right. Our next caller is Krishnan calling in from Hyderabad. Krishnan, what can we help you with?
Good afternoon, doctors. A great service and NDTV team. I have two questions here. One, as I come across here and there that the recovered cases after a couple of days when they are tested again seems positive. Why not the doctors suggest them for extended isolation? And the other question is, here and there now we started blaming the American administration for not declaring lockdown, whereas unfortunately Indian government is also blamed for declaring lockdown across your debates on the screen. And I want a convinced clarification from the doctors on the screen that lockdown to India is appropriate at this juncture. Thank you.
Right. Dr. Neeraj, would you like to answer that?
Yeah. So as far as infectivity is concerned and the test remaining positive, even after a patient has recovered, we've seen that with H1N1 also. And the test can remain positive. Now, there is no hard data on the period of infectivity. Normally, we take it at 2 weeks, but it could be longer. So it is very important that people still maintain the precautions that they've been told. So hygiene should become a habit with us now, for the next, for the lifetime, basically. And, this will come in helpful anyway. Now, in terms of, infectivity we'll have to wait for data. I don't think we have enough data on the virus as such. The second part of the question, sorry, was relating to the... Hello? Sorry. What was the second part of the question? Doctor. Yeah. So the lockdown, in my opinion, let's understand the disease. The disease is spreading very quickly in communities where there is a crowded, population. Now, in our country, we are a populous country, and the basic hygiene is lacking in most of us in the community, purely because of overcrowding, if not other things. In our country, it was important to recognize the seriousness of this disease and try and cut down the spread. I have said this before, the numbers will come in, the numbers may increase, but it doesn't mean very much for us. We should not panic with that. What we have done as a lockdown, I think, is very appropriate. And if we can cut short the transmission of the disease and tide over this crucial period of 4 to 6 weeks, then we have gained in the long term, both in economic terms and as far as our health is concerned. So, in my opinion, we have done absolutely the right thing. For once, I think the world is appreciating that India has taken action before any other country could. And we do see a lot of unfortunate countries suffering because I think people took it a little more casually than India did.
Right.
So I think we have done absolutely the right thing.
Right. We have a next
caller coming in. And I would like to really second what Dr. Neeraj said. I think this is fantastic that we've taken a lockdown. We've taken a very proactive approach. I think, if we are able to get this under control, we will be an example for the rest of the world as to how to deal with pandemics.
Absolutely the need of the hour. Our next caller is Anshuman Kohli calling in from Gurgaon. Anshuman, what's your question? Okay, we have our next caller, Ramesh Dhar, calling from Kolkata. Ramesh, can we help you with some of your queries?
Yeah. Good morning, doctors. Good morning, doctors. Hello, good morning, doctors.
Yeah, good morning. Please go ahead with your question.
My question is, if I get in contact with a virus-affected person today, do I become a potential vector immediately? Meaning, can I immediately affect another person?
Oh, yeah. Okay. So, Dr. Sameer Gupta, how long before you can pass it to someone else?
So the data for that is actually not very clear. But you can spread it actually, now you spread the infection by 2 ways. First is that if you have the infection, and so this infection, from what we understand, is in our respiratory system, in our saliva, in our lung. So when somebody talks or when somebody sneezes or coughs, small droplets of the saliva come out in the air and they go settle on various surfaces. Now, if somebody else comes and touches that surface, for example, there's this phone in my hand, right? Now, if somebody comes and somebody there's a virus on this phone, then somebody else comes, touches this phone, so now the virus comes on his or her hand, right? And now he touches it, the face, hand, etc., and you can get infected. But if you don't touch your face, you go touch this from your hand, you go touch another surface, the virus is now on that surface. Now, what is the quantity of virus that goes from place to place is actually to be determined. There is not much data for that. But this is how the virus spread. So if you've gone and touched a third surface and somebody else comes and touches that surface, even though you may not be infected, you can possibly transmit the infection. So I don't think it is just that the duration. And also, typically when we test somebody who's been exposed, is then after 72 to 96 hours, after 3 to 4 days. So that is when the virus is actually there in the system. So I think from an infectivity standpoint, if you're exposed, I would say from day 2 to day 3. However, if you've touched a surface and you have the virus in your hand, then you can go ahead and transmit it from place to place also.
Right. Rajshri calling in from Bengaluru. Rajshri, what can we help you with? Rajshri?
Yeah, I'm online, yes.
Yeah, please go ahead.
Yeah. So am I live with the doctors right now?
Yes, you are. Please ask us what you'd like to know.
Okay. So good afternoon to the panel of doctors over there. My name is Rajshri and I'm calling from Bengaluru. Doctor, the thing is, in Bangalore at this time of the year, we usually have a lot of pollen in the air. And there's also a lot of dust all over the country at this time. So, you know, any family member having a dry cough is kind of just panicking me off right now, you know. So my question to the panel of doctors is that if you can recommend, you know, what is the tipping point at which an individual should seek medical attention? The reason I'm asking this question is, you know, there's also a counter advice which is going on right now that we should avoid visiting the hospitals, you know.
Right.
So if you can suggest us, you know,
Dr.
what are those
Neeraj,
vital indicators we must look for before heading towards a test or heading towards a doctor? Thank you so much.
Dr. Neeraj, would you like to answer that question? Change of weather and everybody is prone to getting sick. So at what point does one get checked?
So it's very important to remember, if you don't have fever and you have only symptoms of a cold or rhinitis, as we call it, which is sneezing, runny nose, a cough, a throat irritation, then you don't need to worry that much. So there are two aspects to this. If you get a severe allergy only, your respiratory system is more prone to getting an infection also. So in that sense, you must take precautions so that you don't pick up an infection from other people. So you have to be extra cautious and take your treatment accordingly. Similarly, people with allergic asthma in this season must take their asthma treatment, because otherwise, if your lung airways are inflamed, you are more prone to picking up a viral infection. That's one. Secondly, you should seek help only if you get fever with breathlessness along with the symptoms that you've described. I'm repeating myself, 90% of normal individuals who get these symptoms will recover with rest and precautions. So there is no need to panic or rush to a hospital or rush to get tested unless you have breathlessness, which is not, out of proportion to your normal breathing, or you're getting high fever, which is not going away, or you are in a high risk, which means you have, either somebody is elderly, or you have chronic lung disease, or cardiac disease, or kidney disease, or you're on immunosuppressants for any reason, or, people on chemotherapies. Those are the people who need to rush to their doctors urgently. Otherwise, rest of the people can just stay put at home.
Take care, stay home, stay safe. Thank you so much, Dr. Neeraj, joining us, and thank you so much, Dr. Sameer. We'll keep getting you more updates on the coronavirus. Do stay with us.